Hey guys, welcome back again. So this video is just me talking about PCOS and my struggles with it. Um, I mean, not everyone is gonna know what PCOS is. So I'm just gonna read a little something here. It's PCOS stands for polycystic ovary syndrome. Um, Also known as polycystic ovarian syndrome or Stein-Leventhal syndrome. It's a condition that affects a woman's ovaries. It is characterized by polycystic ovaries, cysts that are developed in the ovaries, irregular or no menstrual periods, irregular ovulation, and high levels of androgens in the body. And androgens, if you're wondering, are actually male hormones. So women with PCOS usually have problems getting pregnant. I was diagnosed a few months ago. Um, I never even knew this existed, didn't know what it was. I had one friend who told me that I might have it. However, I didn't pay too much attention to it. After finding out about it, I just went into a walk-in clinic, and she had me going for a pelvic ultrasound. After going for a pelvic ultrasound, she didn't actually even tell me that I had PCOS. She referred me to a gynecologist. While she was out of the office, I just quickly opened up my folder, and it said there PCOS with a question mark and a yes underneath it and some other writing. So right from there, I knew that, I went home. I was searching up for it. And when I started reading about these signs and symptoms, I started realizing that this is definitely something I have. So I'll just continue to read here. So a symptom is something only the patient feels and describes, such as pain, while a sign is something others can identify, right? So we're just the difference of symptoms and signs. So the most common signs and symptoms of PCOS are irregular or no menstrual periods, problems getting pregnant. This could be because there is no ovulation or it is irregular. Um, Hirsutism, which is excessive hair growth, usually on the buttocks, back, chest, or face. Hair loss from the head, acne, pelvic pain, patches of dark skin at the back of the neck, possibly some other areas of the body. This is caused by too much insulin. So for me, I definitely have the irregular menstrual periods. Um, Up until October, let me just look at my calendar, my handy dandy calendar, because I've been trying to keep up with everything. So October. Okay. Okay, actually September. So from January 2012 up until September 26th, 2013, I did not have a period. So that's a total of about 21 months. Um, at first it was, I always had irregular periods. Sorry, I'm just jumping all over the place again. Ever since I first got my my cycle, at first it was regular and I was not so big then. But once I noticed that I started getting bigger and bigger, I started realizing that it was not coming all the time. Mind you, when you're a teenager partying all the time, you couldn't care less if your period was coming or not. But once I want a family and I was looking more into this, I did start worrying about it. When I was in this 21-month period, I did go see a doctor, and surprise, surprise, the doctor told me that this was normal. And I was just really scared that I might have uh, a blood clot. I was scared that I might die from a blood clot. But when I went in, the doctor said that, so when this happens, and I should just wait to see a gynecologist, and they would be able to help me more. So pretty much I just, whatever, okay, done. So then a few months after that again, which is just recently, then I decided to actually go and see a gynecologist finally. So my gynecologist put me on something called Provera, and I had how long did I take Provera? I had taken it about 5 days before it actually kicked in. I believe the 1 week point that it kicked in, which was the 26th, and then I had it up until the 3rd. And then it came up, and then it came back again on the 12th of October and ended again October 17th. And from October 17th until today, I still have not gotten another menstrual cycle. So obviously, no menstrual cycle, no baby. And that's something else that I do is I do believe that I suffer from is the ovulation. I believe that I believe I don't ovulate regularly. My husband and we have been trying for about 2 years now, and it has not been successful. But I do believe that, you know, um, I'm a Christian, so I do believe I will get there. If, God wants me to have a baby, then I'll have a baby. Another thing that I do suffer from is the hair growth. I don't have it excessively in my buttocks, my back, chest, no, just on my face. Just recently, I just started getting this grown all the time. Like, never had this problem before, but now I find that every week after I get this done, just like a few days later, bam, back. Acne I never really suffered with, pelvic pain not so much, and the patches of the dark skin I do get around here in my neck area. And like it says, that's from insulin. So a lot of people with PCOS also insulin resistant. I don't know too much about that. I don't know if I am. I actually am still going through the process of checking with my PCOS and obesity with my doctor. So I still have an ultrasound and some blood work to go. My ultrasound is for is set for December 4th. I will definitely keep you guys updated. I just wanted to talk about PCOS with you guys, and I mean, there's so much more I can cover, but I don't want to take up too much more time. But definitely, it's nothing that, it's not nothing funny. It's hard. A lot of women that go through this. I'm in groups and I read that women who have been married for 10, 13, 14 years are still trying to conceive. And, it's not an easy thing. So I do believe it has a lot to do with the weight. I believe that once I lose this weight, I will be able to conceive and have a baby. You know. So I will definitely talk more on this next time around. If you have any questions for me, then go ahead and leave it in the comment, or if you want to message me personally, then definitely go ahead. I guess, oh, sorry, one big thing that I missed out is the losing weight part with PCOS. The weight is gigantic. Almost not every, but most women who have PCOS is either obese or overweight. And the thing about us is it's so hard and so different to lose weight compared to, say someone, let's say I was 250 pounds. And someone else I knew was 250 pounds, and I had PCOS, but they didn't. This is the best way that I always tell people. We can literally do the same exercises, eat the same, drink the same, do everything the same for 2 weeks. The only difference would be the outcome of the weight. That person would lose about 10 or 15 pounds, where I would lose maybe 5 if I was lucky. So it is just because our insides are so messed up, signals are wrong, and just it's all over the place. So it is hard. It's something that people do not know a lot about, and I believe that everyone should know what PCOS is and that people do suffer from it. And I guess it's just my way of showing, or my way of giving back to letting people know what it is and how severe it is. So yeah, definitely go ahead. If you think you have these symptoms, then look into it. Try to fix it now. And I guess that's all for it. I'm trying to think if there's anything else I want to cover. Nope, I think that's it. I will talk to you guys later. In a few days, I will make another video again. Alright, well, yeah. Thumbs up. Bye.